Today we have Bonnie Michelman, past president of ASIS International, also the executive director of Police, Security, and Outside Services for Massachusetts General Hospital and Mass General Brigham, who's going to share with us and address the challenges of providing security during the global pandemic and the impact on social professionals in the Boston hospitals.
Hello, everyone. I wish I could see you all, but I'm very thrilled to be here to talk about a little bit of one healthcare system's experience during a long disaster or the pandemic. My story is interesting. I represent 17 hospitals in the mostly Massachusetts area, New England area, the largest being Massachusetts General Hospital. And that's really the hospital I'm going to be talking about the most. I think you might find some of the things I'm about to share something you can resonate with and that resonates with other disasters that you may have had or you may have planned for. So we have a 30,000 person hospital in downtown Boston with hundreds of offsite facilities. As I said, we have 16 other hospitals all over, some small, some large, and we are unifying this large system even more than we have before, which creates some interesting challenges during a disaster, which this pandemic has been. So prior to the surge, prior to the patients that we got, and I'm going to talk a lot about the surge, started understanding that there was serious problems coming to the U.S. with COVID-19, that we were going to be hit with people that were affected. We had no idea to the extent or how many or how acutely. We worked with our partners in the city, state, and federal government to understand guidelines, and those guidelines kept changing, particularly by the CDC, the Department of Public Health, etc. We were sure that we knew our leadership, which is down pat during a disaster. We formed our hospital information command system, our HICS system, which is basically something that needs to be done during any disaster, and I'm sure most corporations have something equivalent. And we formed a HICS structure both for the corporate entity and for each hospital. In my own department, I decided as we were seeing what was coming down the road, and still we had no idea how extreme it would be. At the beginning of March, myself with my senior team, we put together a 15 to 20 page plan for our department. We had green, yellow, and red. We had what would be in phase green, where we might be planning some things for a disaster, but we weren't really seeing a lot yet. We had a yellow plan of what we were going to do when we started getting patients, when we started having some issues around maybe limiting people coming into the hospital, how we were going to screen them. And then we had a red plan that would be if we were really inundated with a vast amount of COVID positive patients and needing to do testing and all of that. We thought we'd have weeks and weeks in between all of them if we needed to go to red at all. Little did we know we had to go from green to red within the space of about a week and a half, and we didn't have a lot of time to use our plan other than the red part, and we had to keep revisiting that and modifying it as we went along. We set up training for all of our staff. I have about 400 people in various departments that work for me at Mass General alone. We set up task forces within the department and also multi-disciplinary task forces to look at all kinds of things, whether it be access or screening or visitor control or patient acuity or changes in the emergency department. We had some significant issues with parking and transportation. For example, we have 11,000 people at Mass General that take public transportation to work. The public transportation system in Massachusetts, the MBTA system, basically stopped. There was very little, it didn't entirely stop, but many routes were not going, many trains were not going. The subway system was at a very huge decline, and people could not get to work on public transportation. That was an enormous problem because some don't have cars, some didn't have any other ways to get to work. Plus, we had to think about how to park thousands of additional people who could drive to work in a space where we didn't have any more parking spaces. So we had to think about that. Resource coordination. We had to coordinate resources with all of our partners throughout the healthcare organization, all of our partners outside. So we had to make sure we had the right supplies, the right uniforms, enough radios, enough batteries, enough stanchions, all kinds of things that we knew we would need for this kind of a disaster. And again, at that time, we simply had no idea it was going to be as large and acute as and long as it has been. So that was a little planning. Then the surge happened. At the peak of the surge in April and May, we had up to 500 patients that were COVID positive. And these were patients that were extremely acutely ill. Many had come from other places that where they couldn't be treated. Many were on ventilators. Many were in intensive care units. We have 4 intensive care units. We had to transfer 12 additional units into intensive care units to be able to care for all the people that needed this level of care. It was extremely stressful for all staff. There were issues because we weren't allowing any visitors in, so these patients were alone. They were incredibly ill alone. Some were, having issues around mortality. Some, had issues around disabilities. Some had issues around behavioral health or mental health issues. But we were keeping visitors out for the most part, with some exceptions, because we needed to ensure that our staff was as safe as possible and we had as few people in the hospital as was essential. We knew that even though we have a huge capacity, we're one of the largest individual hospitals in the country, we didn't have enough space for all of the people that we might be getting that had COVID or that were a COVID risk patient. So we set up in the convention center in Boston. We were asked to set up a mobile hospital, which we did within maybe a week and a half. It was miraculous. 500 beds were for post-acute COVID patients. 500 beds were for homeless people that had COVID or suspected COVID. We sent doctors and nurses and other healthcare professionals to that site, again, taking them away from the mothership where they were vastly needed too. So staffing wasn't easy. We took over a hotel in one of our local communities that was having a higher than usual incident of COVID with their population, one of the highest in the country, in fact. So that, and part of that was because the people were living in that community, a lot of underrepresented minorities, a lot of immigrants, people living densely in small areas with large families. So in order to make sure that people weren't transmitting it from family to family, we took over the hotel and put the person that had the COVID in the hotel so that their family members wouldn't be, it wouldn't spread to them. And we staffed that. We had testing sites, drive-through testing sites, and testing sites at our facility all over, both at our off-site facilities, at our other hospitals, and certainly at our main hospital as well, for people that needed to have testing. Those were appointment-only testing sites. Some people just came in and wanted to be tested, got very upset when they couldn't be. And we had to be very careful about how these people got in and out. We had to make separate parking areas for them because obviously with them suspected of having COVID, we didn't want them touching elevator buttons or pulling tickets that other people would be touching, etc. So all of this had a variety of challenges. In that community, Chelsea, that I talked about earlier, where we took over the hotel for some of those people, we wound up doing an educational campaign, delivering food to 35,000 residents, doing testing for almost that many, and really trying to do a whole lot with community health for that community to help get their numbers down. They were astronomical in terms of their COVID positive rates. We had to think about infection control throughout the whole hospital. How do you clean everything? How do you clean public bathrooms, elevator banks, parking buttons, elevator banks, etc.? We had to think about our employees, and we had hundreds of employees throughout the hospital during the whole first 4 months who got COVID, including some people on my staff. Didn't necessarily think they got it here, and the numbers were actually small given the numbers of employees. We have, again, 30,000. But obviously, we had to be extremely conscientious and cautious and conservative about those people who either had symptoms or had COVID or had family members with COVID to ensure they weren't in the hospital. We had issues with supply chain, and I know many organizations did. Certainly in healthcare, we did, having to safeguard supplies in a very different way because masks and face shields and N95s and gloves and CalStat disinfection materials were sorely needed and were being stolen in different places. So we had to be sure that we were able to get the supplies we needed and keep them. Access to the hospital, again, was very difficult. On an ordinary day before COVID, we had close to 80 entrances where about 50 to 60,000 people a day come in. We closed down all but 4 entrances and started screening everyone who came in. That has not been easy. We're still doing that, and it is very, very difficult. Screening them to make sure if they're a patient that they have an appointment. Screening them if they're a visitor that they're on an exception list and can go in to visit someone. And there are some patient populations that do have exceptions to this. And now we are actually allowing inpatients to have 1 visitor. Screening people to make sure they were masked properly, and even if they had their own mask, they had to put on a hospital mask. Screening to make sure people CalStatted their hands, and making sure all employees that came in had a badge and that were attesting that they had no symptoms. We were attesting with everyone, vendors, contractors, which we had very few of, that people had no symptoms. So this has been an ongoing process that's been extremely difficult and challenging, and frankly makes people very upset because sometimes they have to wait in line to get to the information desk to make sure that they're a patient or allowed to be a visitor, and screening that they have no symptoms and haven't been around anyone who has COVID. So this has been the biggest load for my staff, and it's detracted from people being able to do the proactive things that they usually do in the whole world of enterprise risk and security. Our patient load was high. Other than a couple of hospitals in New York, we had the highest number of COVID patients of anyone in the country. And I'm very proud to say we had the lowest number of deaths of any hospital in the country for COVID patients. Given the numbers we had, that was extraordinary. It says a lot about who we are, I think. Staffing and morale throughout the hospital was tough. Nurses who had never or hadn't done intensive care unit work were being trained or were being resurrected to do that work because we needed so many ICU nurses. People who were in the end of med school and nursing school were being graduated a little early so they can come in and support hospitals, not just ours. We were getting a lot of traveling nurses and other clinicians that we needed to get because of the numbers. So there were people in our environment that really weren't our employees that we didn't really know that well. We had to screen them. The other thing that was interesting is people were wonderful about wanting to donate, whether it was supplies or food for blood, but these donation challenges got to be difficult at times. People were sending, or extraordinary amounts of food. We weren't sure where to keep it, who to deliver it to. People who wanted to give blood, it wound up being a little chaotic, so we had to have appointments. And people who were sending supplies, we obviously had to do a quality control on those supplies. That was really, really difficult at times. There was one wonderful shoe manufacturer who wanted to donate 30,000 pairs of shoes to all of our employees, but they weren't doing it by, they had no idea what sizes people needed. We don't have a lot of extra room, so where were we going to keep all this? We had to use a couple of conference rooms for all the supplies we had, and we still are using those conference rooms in general anyway. So the donation stuff was interesting and has been, but suffice it to say, people had wonderful hearts and were trying to do great things. We had to limit vendors and non-essential vendors and contractors. We stopped all construction. We have usually hundreds, if not thousands, of vendors, salespeople, etc. Here during the day. That had to be stopped. Again, we were trying to minimize the number of people that were in the hospital, and I personally felt very safe being here. I felt it was more safe than being in the supermarket, to be honest. We started doing about over 50% of our ambulatory care visits via telehealth, as most hospitals do. We had been working on telehealth and to make that system much more sophisticated before COVID. Well, it became very sophisticated during COVID, and a lot of people worked very hard to ensure that we had excellent abilities to be able to keep our patient load going, even if they couldn't come in here. Violence. We found the first few months of COVID, and like anyone else, our emergency department has a fair amount of violence, and we've got issues in the as you might expect for a large place. We had very little for the months of March and April and even the beginning of May. And that was a glorious relief, obviously, because it allowed us time to do some other things. And then the violence started seeping back up in late May and June, and we found now that we're having a significant issue, particularly in the ED, with a lot of behavioral health patients who are very distraught and very stressed out, and a lot of volatility going on there and in the floors. And even in the lobbies, when people are told they can't stay or they can't visit or they can't wait in the hospital or other kinds of things. We found we had a lot of issues with cyber attacks, cyber activity and fraud and extortion, a lot of scams. And I know we weren't alone. People were told that a lot of people got employment-related letters from supposedly the government saying they had applied for unemployment and weren't getting it, or they needed information to get it. There were other kinds of scams. But the bad guys really capitalized on the pandemic by trying to put a lot of people in harm's way, and for people that were maybe not quite as astute, maybe living alone, maybe older, there was a lot of problems with this, and people were victims of this at the hospital as well, employees, certainly. We had some fraud, we had financial fraud, we had some extortion, we had some other things going on. We also had a major labor pool from people that were able to work other jobs because either their practices were closed or their offices were closed, or they just couldn't work, or they were working at home. And many were retrained to help us in the lobbies or to help people do other things throughout the hospital. So we had a large group of people that were cross-trained to do other things. That was extraordinarily helpful. We probably couldn't have done what we did with the number of patients we had. Not only the 500 or so that may have had COVID and been many of who were very sick, but also with the other hundreds and hundreds of patients we had that didn't have COVID, that were very sick and needed other things. And even, simple things like having a baby wasn't particularly easy, and still isn't during COVID, when, you couldn't have everybody come in to visit you, and, only your partner could come in to help you, obviously in labor, and some hospitals didn't even allow that. So, a lot of challenges throughout, and some of them are continuing, but during the first 4 months, it was very, very difficult for all of us. So in looking at recovery and challenges, we still are in the midst of this. We had to get people back into the hospital, both patients certainly who needed help, who needed healthcare, who had put their needs on hold for many months. For the hundreds and hundreds of people that, even, I'll give you an example, in the mammography clinic, they were canceling 160 or 170 people a day during the pandemic. So you can imagine the challenges in trying to get people back into all of the practices, people who had put off surgery, etc. We needed to do everything we were doing in terms of recovery, and we're still in recovery, according to the phasing of the state, what the governor wanted, what the CDC wanted, and what we were allowed to do in our city. We found our inpatient and outpatient volume and procedures had to change. We had to expand scheduling. We had to continue with telehealth appointments. And we had to kind of be creative. One of the wonderful things that has come out of this is I think everybody's learned to be very creative about different things and innovative. And I think we've learned a lot in our department about different ways to do things. We had to stop doing some functions that we were doing to be able to do some other things. We're heading up all of the lobby and screening and visitor practices. So we've had a lot of issues around that. Can't do some other things as much as we would like to. So we've gotten creative. We had to get rid of people's fear about coming back to a hospital. And there's been a lot of media around that and a lot of reaching out by our public affairs department and our physician leaders and others to tell their patients that it's safe here, and it really truly is. Visitors are our most complex issue. Very, very rarely do people want to be in a hospital without someone that a loved one with them. And right now, we allow one person for inpatients, but for outpatients, and there's thousands of outpatients a day, we really don't allow anyone to come in with them because it's just the fact we can't have people congregate together in waiting areas where we cannot get 6-foot distances. So it's not that we're not wanting to let people in, it's just we simply can't, given the constraints, the physical constraints that we have. And that's tough. You drive somebody down for several hours from Maine to go to a Boston hospital, and they're going to be in either getting an chemotherapy infusion or getting a colonoscopy or whatever they're in for, or they're going to possibly get bad news from an appointment, and you don't want them to be alone. So this is very tough stuff, and we're working through it as best we can. Transportation has been another challenge. So the public transportation system is not back fully, but it is back somewhat. And we did park several thousand people in our front garages that were for visitors and patients during this time, because we didn't have a lot of patients and visitors who had cars. But then we had to move our employees back and ask them to start taking public transportation again. And as you might imagine, not everyone has wanted to take public transportation again. So that's been an interesting, phased, iterative process. Employees are returning to work who are working at home for several months or not working at all. And some are, finding that a little bit scary, a little bit uncomfortable, and others are doing well, but we're trying to help with that transition. We've changed our lobbies, those 4 lobbies that we're accepting people in, so that we're streamlining the process and trying to get them in as easily and as fast, but as safely as we can, so that they are not held up, but yet that we know that anyone walking through our lobby is free from any symptoms, is got a proper mask on, and has certainly disinfected themselves. Staffing issues have been hard. We're trying to hire some additional staff for some of these areas we need them. It's not always easy to do that. People sometimes would prefer working in Costco or working in somewhere else than coming to work in a supermarket as a temporary employee. Capacity, we're finding, is also difficult because we've got so many people that need health care. And we've only got so many physicians and so many offices and so many nurses and so much bandwidth to be able to take so many people at once. You can't really make up for 4 months quickly. Our offsite facilities we have a lot of ambulatory practices in different areas and research facilities. We're doing the best we can in making sure those facilities are safeguarded, that they have what they need in terms of supplies, that they have testing facilities at some of the off-site facilities, etc. But these are never easy. In terms of lessons learned, kind of the next slide, I think we've seen the good, the bad, and the ugly, as I started with. We've seen a lot of stress. This is a longitudinal disaster. This is really important. Most of us have done a lot of work practicing for disasters, disaster planning and preparedness. Not many of us have done a lot for a disaster that lasts for months, possibly even a year or more. And I think that's what's different about this, and the uncertainty of when it's going to be over. And that is putting everyone on edge. The most centered people I know are on edge from this, and having some good days and not having some good days also. And because of that, people are a little more anxious, they're a little more sensitive, they're a little more paranoid. They're obviously got their own personal issues, worrying about COVID or someone in their family, or possibly financial issues. We have to be sensitive to that. As security professionals, we have the chance, and I tell people this all the time, and I mean this, to strut our stuff and to show our value in ways we have not had this opportunity before. So we should take on anything we can to help our corporations do the things they need to do during this pandemic, to be especially valuable, to help with safety, to help with whether it's people working at home or people coming back to work, to help with ensuring transparency for our clients or customers, whatever that is. But we have to help with managing emotions. We have to help with managing exhaustion in our own staff if we're working. And some of you have been probably working at home the whole time. And that in itself has its own challenges, I'm sure. I wouldn't know, but I'm sure. But either way, it's not easy for people right now. It's not easy with childcare. It's not easy for teaching people at home, etc. We are uncertain about the future. We have to teach people that that's okay, that we don't put our lives on hold, that we do the best we can, and that we serve our populations in a positive, genuinely caring way. Not that we're have to act all the time and be in a great mood, but that we show that we've got this under control, we know what we're doing, and that we are resilient. And resiliency is the key word. I know you've all heard it way too much right now. It's probably going to be the most popular word in the dictionary next year. But resiliency is our best friend, and we have to be really good to ourselves before we can be really good to other people. We also have to be creative about how to boost our morale, to know when we need to take a break. And, people have their own, I call it the continuum of fear. Some people aren't worried about this at all, or they're pretty loose about where they go and what they do. Other people are extremely nervous about it and don't want to be near anybody and don't want to be in anybody's presence and don't want to touch anything. And we have to be respectful of either of those continuums because people are very different about where they stand on this. We have to remember to make systemic or technology changes when it's helpful to us to do that. We have to continue our work on training and preparedness and real-time intelligence mobilization, so we know what's going on, we know what's coming down the road as best as we can. And we have to recognize that there are other factors in this country right now and abroad that are also exacerbating this. Certainly the racial injustice that we're seeing and the work around that. The election in this country is creating quite a bit of angst for people. So all of these factors can create some divisiveness, some anxiety, and this ongoing pandemic, hopefully will get better soon, certainly doesn't deflect any of this. It just tends to feel very cumbersome and heavy and hard. And I think that it is our job to help people get through this, to help our staff remember how important they are during this. We've had some great success with getting closer and with other departments during this and learning that we have great partners in places we didn't even know we had, and that we have people with skill sets that are kind of leaving their lane to get into other lanes. So all of that's really helpful too. I'm going to stop here and thank you very much for listening today, and very happy to take any questions from Debbie and from any of you if you'd like to email me down the road.
Thank you, Bonnie, for sharing the massive challenges that the healthcare industry, and particularly your organization, has faced during this time of pandemic across our globe, and especially there in Boston. I know you shared so many, but could you share the top 3 challenges that you faced during this time and lessons learned?
Sure. Definitely the number one is keeping people's morale up during times of exhaustion. People were working a lot. People were concerned about their own families and still having to work, having to do very different things, seeing people who were very sick. So keeping morale up. And we did that, by bringing in food a lot, making sure people had some time off, making sure people had some days off, reminding people how important they were, sending, sharing people letters we got. So that was certainly a challenge, a major challenge. I think another was dealing with and this is ongoing, dealing with a lot of conflict with people that don't understand or don't like the rules that hospitals have to have right now around uh, not being able to sit and wait and have coffee or have, we had neighbors, a lot of people around the neighborhood that would eat here every meal. They can't come in and eat anymore. Visitors can't come in, as I've said, for the most part. Patients can't wait here if they come 2 hours early because there's nowhere to wait. We can't get people distanced in a safe way. So we have to be very careful how we do that. That is very hard because we're often in, contentious conversations with people, trying very hard to be as kind as possible and explain it. So I think that's hard. The good news now is we don't have a lot of COVID patients, which is wonderful. And we're grateful for that, and we're praying that Massachusetts continues to do such a great job. We were the third highest state for COVID risk for many months, and then we've been one of the best states for the past several months, so we're hoping to continue that.
Thank you. And my next question is, what is the top issue related to your frontline workers' mental health and wellness that you face during this time of pandemic?
Well, I think I've sort of hit on a few, just with exhaustion and stress about themselves, with professionally and personally. But I think on top of it, unlike anything else, people were worried about catching COVID, getting it themselves. They still are, probably not quite as much as they were. So I think that constant fear we all sort of faced. If you had a sniffle, do we have COVID? Are we here? Are we going to get it? How's it going to affect us? Are we going to be able to see our families? Are we going to, give it to our colleagues? That has been a massive piece on everyone's mind, and I know that's true of everyone, not just those of us in healthcare, but it's really true of people in healthcare. I mean, a lot of our people would go home from work, and still do, and immediately take all their clothes off before they got in the house, have to take a shower the minute they got in the house. That's a very different way to live than usual.
Bonnie, thank you for joining us here on the Global Women in Security Alliance. Very much appreciated what you've shared with us today.
Thank you so much for having me.